Thank you. Good afternoon, and I'd like to thank the Institute of Medicine for inviting me here to talk about Mass in Motion, a statewide effort to reduce obesity in Massachusetts. And a special hello to Bill Dietz from your friends at the Department of Public Health. It's nice to see you again. And also a former commissioner of public health in Massachusetts, Dr. Coe. Good to see you, Dr. Coe. So Massachusetts has taken some of the breakthrough strategies that folks have talked about today and some of the sustainability strategies that was just mentioned and created a campaign called Mass in Motion, really focused on eating better, moving more, a multifaceted state initiative that started in 2008 when we really started to see the parallel trends of increasing chronic diseases and obesity and overweight. And so we put together a call to action report that really showed what the burden of overweight and obesity was and how it was influencing health in Massachusetts, and then some recommended strategies to address it. And with that, we had several approaches and prongs to this campaign. Some were executive orders from the governor. Executive Order 509 looks at procurement standards for all of the food that's procured throughout the Commonwealth and making sure that we're procuring healthy foods. And then regulatory approaches, which included a BMI regulation that requires all students in grades 1, 4, 7, and 10 to have their BMI screened every year and to have that aggregate data reported to the Department of Public Health. We implemented in 2010 school nutrition regulation that implemented standards in our competitive foods and in our vending machines and implemented through all of our school system, as well as the formation of wellness committees in all of our school districts. We've had public information campaigns, and we have a website that gives all sorts of tips to families, communities, schools, and work sites on what they can do to promote health and wellness in their settings. And really the cornerstone of our work has been the municipal wellness grants that we fund throughout Massachusetts. And these were grants to really look at changing the approach to public health to address obesity and taking some lessons from tobacco, where we really wanted to stop putting our resources into individual counseling or clinical interventions and really changing policies, systems, and the built environment so that the healthy choice was the easy choice in our communities. And so we started out with a pilot program, and this was a unique funding partnership. It was a public and private partnership. We created this initiative just as the budget and economy started to go south on us, and we had in our health promotion budget a 60% reduction in our funding. And so we needed to be creative, and we brought together 5 health foundations in Massachusetts, and actually our largest insurer, Blue Cross and Blue Shield, where they contributed collectively about $800,000, and the department added $200,000, and we gave out these initial pilot grants to municipalities who were willing to have the highest elected official engaged in a diverse coalition that really went out and assessed the community to see what the barriers to healthy eating and active living were in their communities, and each year committed to having one strategy to make a change to promote healthy eating and active living. And so we hired, most municipalities used, they got $60,000 grants, small amount of money, really had significant change to have this multi-sector approach where they hired Mass in Motion coordinators who brought together all the sectors in a municipality and started thinking about health in all policies. What were they all doing that could mutually benefit each one of their individual sectors, but at the same time really promote health? And each year, as I said, they have to do one strategy in each of those areas, and they've done all sorts of interesting things, from having corner store initiatives, farmers markets that are mobile that go to public housing facilities, public farmer markets that are in the wintertime, and we have community gardens. We have the implementation of our school nutrition standards. We've had a really increased in building of sidewalks, repairing of sidewalks, making sure there's lighting and safe activities in communities, joint use agreements that you just talked about opening up some of our colleges so that at night people can go out and use the universities to get physical activity. And so a wide range of strategies. And we used the CDC's change tool as an assessment. Every community had to do an assessment of their community and identify what the barriers were to healthy living and healthy eating and active living. And so we started out, as I said, with 11 municipalities. Over a couple of years, we were able to find some new private funders and expanded to 16. Because of the early successes that we saw with this work, we were able to apply for community transformation grants. And we were the only state that was awarded 2 community transformation grants. And so we were able to go from 11 municipalities to now we have 52 municipalities and representing about 33% of our population. And so each one of these communities not only is Mass in Motion, but they've expanded to have that community clinical linkage to address chronic diseases and tobacco with our community transformation grant. And we were really pleased to see that from the start of this program in 2008, that this is our BMI data in our schools. We've had 4 full years of our BMI reporting, and we have seen a significant reduction, and particularly higher in our Mass in Motion communities. And this is true in both genders, and we see the biggest reductions in grades 1 and 4. And our BMI has been an interesting implementation. We've had a little bit of news about that, where in the past year we rescinded the requirement of sending a letter to parents. We had, as part of our BMI regulation, that we had to notify parents of what the score was. And it really created a lot of controversy. And the governor asked us to step back and take a look at whether this made the most sense, because we started to have some legislative attempts to remove our ability to actually prohibit us from doing BMI screenings. And so we were able to remove the letter from our BMI regulations and keep the aggregate data that we think is so important for us to follow the trends in the work that we're doing. And I would just add that we have also struggled with our school nutrition guidelines, that there's been also legislative attempts to make some changes, a lot of parental concern about us going too far and removing the ability to have celebrations in the school that involve cupcakes and sweets, and that has really been a challenge for us. And so I really think that it's important for us to come together so that we don't start to take some steps backwards when people try to legislate these good efforts away. So we're really happy with the results that we're having, and some of the early successes besides our BMI is that we've seen by having this multi-sector approach is that we're bringing resources together from multiple departments to have these built environment changes. For example, sidewalks. In some municipalities, the sidewalk budget is in the Department of Public Works, but they never have enough money. When we had 3 or 4 departments that had a vested interest in having sidewalks, communities within the first year of having Mass in Motion grants were building sidewalks that they didn't have resources before. And another success we're doing, we have 40 miles of aqueduct trail that we are starting to repair and put resources in so that we can have a contiguous 40 miles of walking and biking trails in central Massachusetts. So the really coming together as the sectors really helps us to change the environment and promote healthy eating and active living. So thank you for having me.